We fall in love by chance and we stay in love by choice. Love at first sight, most commonly, people are falling in love, but after that, they had to tolerate everything and to stay in love. That is your choice. Now, what are the complications of the chicken pox? Adults have a higher risk of complication than children, which are joint pain, pneumonia, dehydration, encephalitis, and bacterial skin infection. Those with the weakened immune system due to the cancer, HIV, and other diseases, they are at the higher risk. And another complication is arterial ischemic stroke, AIS, which is seen in chickenpox. Once infected, varicella zoster virus stays in the nerve cells of the body and wake up again later and become active and erupt later in life as shingles, as I have already told you, that they remain dormant in the nerves and on reactivation they just start appearing as shingles. Fortunately, there is a vaccine for the shingles for adults over 60 years. So here one can see the complication, joint pain, pneumonia, dehydration. If the germs get into the broken skin, a bacterial infection can start. If this happen, just have the treatment for the infection. It is usually said that viral disease does not need any treatment, but there is the break in the skin because of these lesions, and there is very easy chance for the entry of the bacteria and to cause bacterial skin infection, which definitely need strong treatment to just curtail the spread of the infection. Now, what is the diagnosis of chickenpox? Primarily based on signs and symptoms with typical rash. Most of the time, one can easily diagnose by the clinical appearance of the rash. Then one can go for the viral culture, testing the blood for the acute immunological response to acute infection, that is by the appearance of detection of IgM antibodies or the previous infection, that is IgG. Vesicular fluid examination for Zank smear with multinucleated joint cell or for the direct fluorescent antibody are also helping the diagnosis. Diagnosis can be confirmed by polymerase chain reaction, PCR, testing of the blister fluid or the scab to confirm the presence of the varicella zoster virus. Prenatal diagnosis of the fetal varicella, if one do have the doubt, that can be confirmed by using the ultrasound. So here the diagnosis, blood test, rash examination, and the viral culture, these can help the diagnosis. Now, differential diagnosis: smallpox, monkeypox, measles, impetigo contagiosa, enterovirus, which is causing hand, foot, and mouth disease, and herpes simplex virus. But their appearance is quite different from the appearance of the chickenpox. Lesions, here one can see the monkeypox versus the chickenpox, and here there is smallpox versus the chickenpox, and here again the chickenpox and the smallpox. And one very important is that the lesions of the smallpox are just similar as one can see here, but in case of the chickenpox, these appear in three phases. Then the measles and the chickenpox that have the different distribution and their lesions are very simple to remember is the common pin. The pin head of the common pin size lesions are of the measles. Now, the other is impetigo, skin infection, distribution there, and then there is hand, foot, and mouth disease that also sometimes give this kind of appearance like the chicken pox, and then the herpes simplex virus that is also give the lesion, but the location and the kind of the lesion can differentiate between these diseases and the true chicken pox. The beautiful bird and the beautiful flower. And as you know, the bird take the nectar from the flower and make the honey for us. So this is the work given to these birds by the god. And similarly, the bees which are also taking the nectar from these flowers and make the honey. Now, the treatment of the chicken pox are chicken pox courses 5 to 10 days may resolve without treatment like the viral disease. As it is said, if you treat the disease, it will resolve in 7 days. If you will not treat the disease, it will resolve in 1 week. So use acetaminophen or paracetamol if the pain and the fever is there. It is safe in pregnancy. Avoid anti-inflammatory painkillers like ibuprofen. Never give aspirin to the children under age of 16. It can lead to a very serious complication called Ray's syndrome. Do not scratch that rash and to cause the itch. It's tempting. It causes the bacterial skin infection and the scarring because it breaks the skin and allow the bacteria to enter the skin. Now, precaution for the chicken pox: drink more water to avoid the dehydration. Do not take oil, spices, and the sour things as the lesion are on the palate, and wear the loose clothing so that you do not have the itch. Now, continuing the treatment, keep cool, take a cool oatmeal bath, wear the loose cotton clothing for skin breathing, dab the calamine lotion on itchy spots. It is being used by many authorities, but still there is no proof that it do help or not. Try an antihistamine. It help relieve the itching and it also act as a sedative to give you the proper sleep. Secondary bacterial pneumonia is treated with antibiotic and sorividine, a nucleoside analog, is effective in treatment of the primary varicella in healthy adults. So here, the treating chickenpox, colloidal oatmeal bath, baking soda bath, calamine lotion, non-steroidal anti-inflammatory drugs for pain relief, oral antihistamine as a sedative also, and certain prescription only when needed if the person is going to have the secondary bacterial infection, and one should have the short nails and fingernails are clipped to avoid the scratch done by scratching, and irritation relief to avoid the bacterial skin infection. Stay hydrated, drink a lot of fluid to get rid of the virus faster via the urine. Avoid hard, spicy, or the salty food that can make your mouth sore. Wearing gloves will prevent scratching and minimize the risk of secondary infections. People are at the risk of severe complication given intramuscular varicella zoster immune globulin, that is VZIG, that will prevent the chickenpox virus to cause you the serious problem. A preparation containing high titer of the antibodies to the varicella zoster virus, that is VZIG immunoglobulin, for the serious looking patient. If one is pregnant, a smoker, HIV patient, having chemotherapy, or taking high doses of the steroid medication, infection in otherwise healthy adults tend to be more severe. So one can have antiviral drugs like acyclovir or valacyclovir, or one can have the immunoglobulin for to avoid the serious complication. The antiviral, it makes the symptom less severe. Take first dose within 24 hours of developing rash, then take a tablet 3 to 5 times a day for 7 days for the complete cure. One can have acyclovir or one can have valacyclovir as oral medication, and this varicella zoster immunoglobulin, which is given as immunoglobulin to prevent the spread of infection. Now, prevention of the chickenpox, hygiene measure, isolate the affected individuals because they are very contagious and they can spread the infection to the others. Contagion is by exposure to the respiratory droplets or the direct contact with the lions. The chickenpox virus is susceptible to disinfectants, notably chlorine bleach, that is sodium hypochlorite. Like all enveloped viruses, it is sensitive to the drying, heat, and detergents. So, how to prevent chickenpox? That is, just set up sick room for a family member infected. That is called stay out or isolation, quarantine, disinfect, and then avoid those infected and don't kiss anyone with the virus. Get vaccination and do not share the dishes with a sick family member, and wear the disposable non-latex gloves when touching the surfaces where the chances of the viruses deposition is there. So the other is prevention by vaccine, varicella vaccine, a live attenuated varicella vaccine, OKA strain, was developed by Michiki Takahashi in Japan in 1970, and immunoassay measures levels of the antibodies against virus that gives immunity to a person. Children be immunized with varicella zoster virus vaccine, first dose at the age of 1 year and a second dose at the age of 4 to 5 years. Here, the idea, beautiful idea of a garden, and the eye has been made in the garden, and there the horse is just grazing the grass. It's really idea of an artist. That is the chickenpox vaccine, varicella vaccine, and Varivax. These are the different kind of the vaccine which are used to prevent the chickenpox. And people over the age of 13 never been vaccinated need 2 doses of the vaccine 28 days apart. Also for the vulnerable people like non-immune women plan to become pregnant but already pregnant are not eligible to receive chickenpox vaccine. A similar vaccine but in the higher dose is available for the elderly who already had chickenpox to prevent painful outbreak of the shingles. All adults who have never had chickenpox or received the vaccination should be given 2 doses of the vaccine at least 4 weeks apart. Vaccination within 3 days of the exposure is 90% effective to prevent the illness, and vaccination within 5 days of the exposure is 70% effective. If one gets sick, symptoms will be milder and shorter in duration if the person is vaccinated. Now, contraindication of the chickenpox vaccine are moderately to severe ill at the time of the vaccination. If the patient is pregnant, an allergic reaction to the gelatin, antibiotic neomycin, or a previous dose of chickenpox vaccine, they are an organ donor recipient, special precaution for the patient undergoing chemotherapy or the radiation for cancer. People taking steroid drugs or other immunosuppressants, people with HIV or another disease that comprises immune system that compromise, immune system, patient who recently had a blood transfusion or received the other blood products, and the risk with the chickenpox vaccine are most common side effect is swelling, soreness, or redness at the site of the injection. Some develop a mild rash or a low-grade fever. Serious reactions include seizures, brain infection, pneumonia, loss of balance, severe allergic reaction, anaphylaxis can occur. Chickenpox during pregnancy cause birth defect for the the chickenpox vaccine can cause the same birth defect, so it is contraindicated if the patient is already pregnant. Risk with vaccine are lower than risk with the disease itself that can kill the patient. So risk with the vaccine are much less as compared to the disease itself. So here one can see the infection to the child, and the child have been given the vaccination that can lead to the viremia, and this viremia virus can go to the trigeminal ganglion. From here, this is going to stay in the trigeminal ganglion, and ultimately it is going to reactivate, and then it can go to the meninges, it can go to the cerebral artery causing the encephalitis, it can go to the eyes to cause the herpes zoster ophthalmicus. So that is the summary of the chickenpox. Symptoms are the fever, rash, headache, and the cough. And do not scratch the skin. Apply the soothing lotion, medicine for the fever, and the vaccination for the prevention, and the wash hand for the prevention. So that is the summary of the chickenpox, and that is the end of the lecture. Hope you have liked this lecture, and if you have liked this lecture, please subscribe and share it with others. And if you have any question, please call me for any kind of query or answer. Thank you very much for being with me